Hello friends, welcome back to my channel Medical Knowledge. Today we will talk about nursing process. So let's start about the topics. At first, what is a nursing process? It is a systematic and dynamic method of providing care to patient, whether the patient is an individual, group, family or community. So next, the steps in nursing process. First one is assessment, second one nursing diagnosis, third one planning, fourth one implementation and fifth one evaluation. So assessment, what is assessment? It involves the collection of data to determine actual and potential problem of the patient, and it begins with nurses first encounter with the patient. Next, types of data. There are two types of data, subjective data and objective data. What is subjective data? Feeling, sensation and perception obtained through patient's interview. There are the patient given information about his or her own status. For example, like symptoms of disease like pain in the abdomen. Next is objective data. What is objective data? These are the observation or measurement regarding patient's health status. For example, sign of the disease like jaundice, bleeding, etc. Next is sources of data. Two sources of data is there, primary and secondary. Primary is information given by patient and the secondary is information obtained from others like history given by significant others, medical records, lab reports, etc. Next is methods of data collection. Some methods of data collection are nursing history, physical examination, interview, observing patient's behavior, diagnostics and laboratory data. So the next is nursing diagnosis. It is a statement of actual or potential problem of the patient. Nursing diagnosis is written for the physical, emotional, social, developmental, intellectual and spiritual aspect of the patient. So in this, what is actual diagnosis and what is potential diagnosis? Actual diagnosis is also known as problem focused diagnosis, which indicates that the problem exists. For example, ineffective breathing, anxiety, acute pain, etc. And potential diagnosis is also known as risk diagnosis, which indicate the problem that does not exist yet, but the presence of risk factor indicate that interventions. For example, risk for fall, risk for injury, risk for pressure, sore, etc. Next is planning. The list of nursing diagnoses is prioritized and patient goals are determined. Nursing intervention are written and expected outcomes are developed. Outcomes are defined as expected changes in patient activity, behavior or physical state and evaluate the nursing intervention. Outcomes should be based on SMART. S for specific, M for measurable, A for attainable, R for realistic and T for time bound. So, goals include prevention, rehabilitation, and address the crisis or urgent needs of the patient. While planning goals and expected outcome, it should be patient oriented, singular goal or outcome, observable, measurable, time limited, mutual factor, realistic. So, next is implementation. In implementation, execution of the nursing care plan, and then is evaluation. In evaluation, assess the patient's response to care and determine whether the patient goals have been met, partially met or not met. So today's topic is finished. I hope you all are understood. If you like my video, share it with your friends and subscribe my channel. Thank you. Keep watching.